Steve Carroll. I'm the chair of the Department of Pathology and Laboratory Medicine. Married. I have two daughters, one in Houston, one in Chicago. And actually, my daughter in Chicago now has our first granddaughter, who is just a little over a year old, learning to walk and get into everything. As far as fun, one of the things that I started doing quite a while ago with my youngest daughter was learning to scuba dive. And what sort of ties into that is that I'm also an amateur paleontologist. And South Carolina actually has some phenomenal fossil deposits, particularly in the riverbed, so it allows me to combine scuba diving with paleontology to do things like hunt for fossil shark teeth. I came to MUSC from the University of Alabama at Birmingham. At UAB, I was the director of the Division of Neuropathology within the Department of Pathology. For the next year, we've got several things we'd like to tackle. Some of the key things we want to address are some of the pressing issues that are very important to the institution as a whole, such as biobanking and the role that pathology will play in that. But in addition, we're taking a very careful look at the research mission of the department with an eye towards expanding that as we go forward. The idea is we want to continue to build on the areas of strength we've got in the department, particularly in areas like hearing research, stem cell research, and cancer biology. And then after we've solidified and begun to expand those areas, what we want to do is to then begin expanding into other areas that are actually critically important to MUSC's missions, such as cardiovascular pathology. Things that I find particularly exciting around here are the opportunities to build in areas like genomic medicine and cancer genomics. So this is something that MUSC has actually done a phenomenal job of investing in. In fact, I think they're ahead of the curve compared to a lot of other institutions. And that's also an area of research that's near and dear to my heart. And the reason is, I think it actually has got the opportunity to really transform the way we do pathology from being something that is fundamentally an approach which is based on the microscope to an approach where it now begins with a microscope and then expands from there out into actually looking at the molecular characteristics of these cancers and how we use that to personalize medicine for a patient with cancer.